Hi and welcome to Don't Get Offended with me, Sarah Donahue. This is an informative shooting from the hip podcast series looking at everything regarding life, both mental and physical, and a look into everyday topics covering a whole host of important issues, casting a more realistic yet blunt view on our everyday life. Today we take a look at something currently very topical, which I think is of huge importance and something which people across the UK have been up in arms about, and that is the fact that our doctors' surgeries are still refusing to see people face to face, or at least most of them are. So let's dive straight in and take a peek at the research and information out there and see what we all think. It's safe to say that the world went on full lockdown the early part of 2020, and by the end of 2020, the majority of people were sick of it, as millions of people lost their jobs, their income, and some of their businesses and other assets, and of course their homes. I'm not going to go into detail about how I feel about the whole lockdown situation and mask wearing, because I think it's total BS. And as many people have said, all of a sudden, no one had flu and everyone had COVID. So during the pandemic, even though it was the flu season, flu seemed to have been cured. However, 2020 saw doctors' surgeries across the UK close their doors for face-to-face appointments. They were ran on skeleton staff, and any appointments for help and advice were conducted over the phone. The problem is that even now, over 18 months later, in fact nearly 2 years, many doctors' surgeries are still operating this ridiculous system and putting people's lives at risk, especially the lives of the elderly, who need them more than anything, especially at this time of year as we come into the flu season. A season which miraculously disappeared in 2020 as they put it all down to COVID for scare tactics. There is a new report that GP surgeries which fail to provide an appropriate level of access will be named and shamed in league tables, as patients are given a new right to demand face-to-face appointments. The NHS is ploughing millions of pounds into a new package of measures aimed at improving access to GPs. But why are the NHS ploughing millions in? And it's not really the NHS, is it? It's us, the taxpayer, who are ploughing millions in for a service we should have anyway, and that we are already paying for and have paid for. It does state, however, and I quote, "Practices which fail to provide an appropriate level of face-to-face appointments will not be eligible for the new funding." However, we don't quite know what appropriate is yet. The British Medical Association condemned the plans. Not the more money bit, I should add. They condemned that not all practices will get the cold hard cash. Also condemning it have been many individuals such as Professor Martin Marshall, saying, "We know some patients prefer to see their GPs face to face, but good care is being delivered remotely and some patients prefer it." Bullshit. So the bottom line is that doctors' surgeries will be getting more money for doing less of a job, and those that really are doing fuck all apart from answering the phone and returning calls rather than seeing patients to give them a proper diagnosis and expert help also expect more money. But for what? Why do they need more money? There's less staff, less work, more people become increasingly ill, and it's all their fault. The great news is that under the new plans, patients will be able to rate their GP practice's performance via text message. So instead of us slating our GP surgery, which many people are doing and no one listens apart from the pet dog, we now have a voice. GP appointment data will be published at practice level by spring 2022, so people will be able to see how well their surgery performs compared to others. The NHS said this will enhance transparency and accountability. So this is actually quite interesting, because it could also be highly embarrassing for many doctors' surgeries. I think many people know that the women that work on the counters at most doctors' surgeries have a bad attitude and can be quite rude. It's been well known for a long time, and no one seems to know why this is. It's almost a sense of power or entitlement they seem to think they have, but once these surgeries start being rated, their attitudes will need to improve because it will all become transparent. I quote, NHS England said the new measures, including a £250 million winter access fund, will enable GP practices to improve availability and increase the number of face-to-face appointments and same-day care. This is insane, giving GP practices hard-earned taxpayers' money in the hopes they do what they should be doing anyway. I just don't get it. And again I quote, the NHS say GP practices must respect preferences for face-to-face care unless there are good clinical reasons to the contrary, and practices which do not provide appropriate levels of face-to-face care will not be able to access the additional funding and will instead be offered support, though it is not clear what the level of appointments needs to be for face-to-face. Now, this money will help upgrade GP surgery telephone systems, which will hopefully drive down long waits on the phone, they say. Although I doubt that, because staff are so lazy in GP practices for the most part that a new telephone system won't help. Maybe simply more staff would help. Or the staff they have now just need a good kick up the arse and the threat of job loss. I think it's safe to say, and most people will agree, that doctors' surgeries have taken advantage of a situation which sees them with less work and the same money. Every other business has gone back to normal apart from GP surgeries, but start offering them money and they seem to soften to the idea that coming back maybe is the right thing to do, but not before they try the tactic of getting their hands on the extra funding while still refusing to see people face to face, saying it's discriminative of people's feelings for their own safety. So how does that work then? Remembering surely that if you thought your life was in danger, then no amount of money or funding would have you open your doors. So the ones that are soon to open their doors because they are getting funding, shame on you. You are in fact hypocrites. And it has to be asked that if all these doctors and clerical assistants that work in doctors' surgeries were that worried and felt that much in danger from coronavirus, then why do we see them out in bars and restaurants and even shopping for everyday to-day stuff? Surely they should all be living like hermits, shielding, but they aren't. So again, it's safe to say they are all feigning being afraid of this non-deadly, deadly virus just to get out of working. They are in fact work shy and knowingly putting people's lives in danger. Shame on them. Dr. Julia Grace Patterson, Chief Executive of Every Doctor, which represents around 1,700 UK doctors, told a briefing on Wednesday, it's a bit of a shock for GPs to have been told by the Health Secretary last year that all appointments should be via telephone, and now we are told the absolute opposite, and in fact blamed for the amount of telephone consultations that have been happening. It seems that Dr. Julia Patterson hasn't noticed that we are now in 2022 and almost 2 years down the line, and everyone else has returned to work, apart from the doctors' surgeries. Every doctor, so again Dr. Julia Patterson, also expressed concern that inflammatory rhetoric about access to GP services was leading to abuse of staff. Well, what does she expect? Doctors and staff wouldn't suffer any verbal abuse if they simply got their work-shy arses back to normal and saw patients face to face. Doctors not seeing and being able to diagnose patients properly is leading to huge numbers of people developing severe illnesses and diseases such as cancer spreading rather than being caught in time and treated. It is shocking what UK doctors are doing at this moment. It's criminal. The NHS state that this new blueprint will also include action on new efforts on how to tackle abuse of staff. But they haven't seemed to have taken into account that they don't need to spend money on that side of things, because if doctors simply did their job as they are paid to do and trained to do, then there wouldn't be any problems with regards abuse. So the best way to sort all of this out is for the government to either demand all surgeries return to normal, or threaten to close those that won't comply down and move patients to alternative surgeries, and spend the money on making those surgeries that are willing to operate as they always have done bigger and more efficiently, so they can handle more patient traffic with those willing to work. Official figures currently show that 58% of GP appointments in England in August were face-to-face. Before the pandemic in August 2019, 4 in 5 appointments were carried out in person. But a new YouGov poll suggests that 2/3 of people would prefer a face-to-face appointment. When asked which type of GP appointment they would prefer, the survey of 5,400 British adults found that 66% would prefer a face-to-face appointment, 5% would like a video consultation, and 25% said they would not really mind what type of appointment they would sooner receive. The problems have started to have a knock-on effect at A&Es, with emergency care doctors saying a lack of GP access is a key factor in the high numbers turning up at hospital in desperate need of assistance, with some A&E departments having people wait up to 8 hours. So what do you think of the UK's doctors' refusal to see patients face to face? Should they do the job they are paid to do rather than take these what are seemingly endless holidays, all while still getting a wholesome full wage off us the taxpayer for doing very little, alongside their work-shy secretaries who are happy to back the doctors' decisions as they too get money for doing nothing? When will it all end? As doctors, don't they take the Hippocratic Oath, one of the oldest binding documents in history? The oath written by Hippocrates is still held sacred by physicians to treat the ill to the best of one's ability. To remember that there is art to medicine as well as science, and that warmth, sympathy and understanding may outweigh the surgeon's knife or the chemist's drug. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. Thanks for listening to Don't Get Offended with me, Sarah Donoghue. And if you like my podcast, please do hit that subscribe button on any of your favourite podcast platforms. Thanks for listening.